Cariño, no. Escucha, ven un momento.
Welcome to the first Para and Inclusive Kickboxing online seminar hosted by WAKO. I would like to take this opportunity to thank the Chairman and the Para and Inclusive Kickboxing Committee for their dedication and work over the last 12 months to develop this discipline and the coaching principles and categorizations within Para and Inclusive Kickboxing. 2 years ago, I witnessed Para and Inclusive Kickboxing for the first time, and I have to say it materially impacted me. To see the value and the persistence of the athletes and the coaches was something that inspired me quite significantly. And I'm very delighted to say that this is our first online seminar, and it is the intention of the WAKO board and WAKO itself to have Para and Inclusive Kickboxing as part of its disciplines. Thank you for taking the time today to come and review this seminar and learn from the experts. Together we can make this happen. Together we can make this a reality to have inclusive kickboxing and para kickboxing as part of our disciplines. So please continue to work together, continue to work hard, and together we can create a great success for the sport of kickboxing and for para and inclusive kickboxing. I'm sorry I cannot be there today as I'm away on holiday in the USA with family, but my energy and my commitment is to para kickboxing and inclusive kickboxing, and let's make this happen over the next 12 months so we can bring this sport forward in this area and develop it globally so all of our members can be represented within the sport of kickboxing. Thank you to the committee. Thank you for being here. I hope to see you soon at the World Championships in Hungary. Take care.
First webinar of para kickboxing and inclusive kickboxing. First of all, thanks to President Roy Baker for his video and total support to this project, and of course for all the members of the committee, and especially to the training team that has worked seriously and very, very hard to make this webinar possible. Mr. Daniel Lopez, he worked in the Malaga University in Spain. He's the boss of the Department of Learning. Thank you to Sheila Espinosa. She's a graduate of teaching disabilities. Thanks to Ana Isabel Sordo, Anita, international WAKO referee, and to Noe that she's psychologist. In this first quarter, we will show you the modality, regulation, and classification. From here, step by step, we will start more specific courses for all those involved in his specialty. The para and inclusive is very important for the kickboxing, for the respect in around the world sport and in our career to the Olympic Games. We are starting a training that should lead para and inclusive kickboxing to the recognition in all the National Paralympics Committee and in the International Paralympic Committee. This should be our first objective, and for that reason, the training of coaches, referees, and very important, responsible of National Federation is our very important mission. Let's remember Mandela's fantastic quote: education is the most powerful weapon which you can use to change the world. WAKO Kickboxing for everyone. Okay, now begin the webinar. Noe and Anita. When do you want? Ana Isabel Sordo and Isabel Centeno. Okay.
Thank you.
Noemi Centeno is a psychologist. and is a master in disability adaptation and education. And Anita, I think that everybody of you knows, is one of the best. It's a pride of Spain. It's one of the best international referees in the world. Okay, what do you want?
Okay.
The webinar is yours.
Thank you, Jesus. So welcome everyone. I'm Ana Sordo, as Jesus has said, and most of you meet me as WAKO International Referee, but today I'm here as Para Kickboxing and Inclusive Committee member. With Noemi Fonteno, we try to help you to have the first contact with this modality. So please, Noemi.
Thank you, Ana. Thank you, Ana. Thank you, Jesus. Thank you, Roy. I'm very, very glad to be here. Thank you, all of you, to take the time to be with us in the first seminar. And as Jesus has said, I'm a psychologist. I have a master's degree in integration of people with disability, and I've been working with people with disabilities for more than 20 years. I'm talking to the computer, so I know you are on the other side, and even if we are used to it because of COVID pandemic, it's still a little bit weird. But I know you are on the other side, so we are doing it together. And the webinar is divided into different sections. We are talking about history of inclusive sports, sport as a tool of integration, benefits of sport for individuals with disabilities, para kickboxing, of course, and figures required for the advancement of para kickboxing in your federation. And at least, but not at last, sport classes. To start, I would like to tell to you some facts about disability. So according to the World Health Association, an estimated 1.3 billion people experience significant disability. This represents 16% of the world's population, or 1 in 6 of us, and this number is expected to increase due to demographic and epidemiological change in the population. One of these changes is the rise of the level expectation. And of course, old age brings with it the possible of having a disability. So it's not only the disability we are born with, but also the disability we can have during our lives. Persons with disabilities have twice the risk of developing conditions such as depression, asthma, diabetes, stroke, obesity, or poor oral health. Disability and poverty mutually reinforce each other. It is estimated that about 30% of people living in poverty have a disability. It is also important to note that a disability will be more or less limiting depending on the opportunities and support that the person receives. Disability results from the interaction between individuals and with health conditions such as syndrome or disease that cause a disability with personal and environment factors. This is very important because there's no two people with disability that are equal. And that's also a thing that we have to take in care with the classification, but we are talking about it later on. Now, I'm talking a little bit, a brief story of Paralympics sport. People with disabilities have always played sport. The first sport clubs for individuals with hearing disabilities, Taubstummen Vereinigung Berlin, was established in Berlin in 1882. However, After the Second World War, the development of sport for people with disability increased due to the large number of soldiers returning from the war injured and or amputees. Initially, it was seen as a part of therapy, but later in became a form of recreation. And of course, now it's a very important part of treatment, inclusion, and so on. The seat of the Paralympic Games was the Stoke Mandeville Games in 1948, which were held alongside the London Olympics. They were called after the hospital of the same name. The German neurologist Ludwig Guttmann spearheaded this game, as is considered the father of the Paralympic movement. Mr. Guttmann wanted the soldiers to recover faster, and he discovered that sport helped this recovery to be faster. And with this idea started the Paralympic movement. These Stoke Mandeville Games were held in Aylesbury. 16 war veterans and women with spinal cord injury took part. There were 14 men with 14 veterans and 2 women. And only archery was competed in. It was a very small first Olympic game. They were named like this. The Stoke Mandeville Games became international in 1952 with the participation of Dutch athletes. In 1960, the first Olympics for the disabled were held in Rome. Only wheelchair athletes took part. Until 1976, the Paralympic Games were the sole reserve of wheelchair athletes. Since then, the most important milestones in Paralympics have been the following. In 1980, the term Paralympic Games came into use and is used until now. The first Paralympic Winter Games were held in Sweden in 1976. For various reasons, the Olympic and Paralympic Games have not always been held at the same venue. Since Seoul 1988 and Albertville in 1992, the Summer and Winter Olympic and Paralympic Games have been held in the same cities and venues. The International Paralympic Committee was founded in 1989, and at the 1992 Barcelona Paralympics, minimum marks were set to establish participation limits, and doping tests were carried out on athletes for the first time. At that time, Paralympic Games became more professional and more equal than Olympic Games. This year we have Olympic Games and also Paralympic Games, and this year in Paris are expected to participate 4,400 Paralympic athletes from 182 countries. And now we are going to watch a short video about a story of Paralympic Games.
The Paralympic Games take place just after the Olympic Games every 4 years. But how did the Paralympic Games begin? First, we need to rewind to 1943 to a man named Ludwig Guttmann and the National Spinal Injury Centre. Ludwig Guttmann was a Jewish doctor who fled Nazi Germany to England. He opened the Spinal Injury Centre in the Stoke Mandeville Hospital in order to treat wounded veterans. Guttmann believed that encouraging patients to take part in sports and competitions was an important part of their recovery. In 1948, the Stoke Mandeville Hospital held the first Stoke Mandeville Games for British veterans with spinal cord injuries. The first official Paralympic Games took place in Rome in September 1960, where the Olympic Games had taken place the month before. 400 athletes from 23 countries took part. The Games grew from there, with more athletes and more countries taking part, as well as the inclusion of more sports and people with different disabilities. In the Tokyo 2020 Paralympics, there are over 4,300 athletes taking part from around 160 countries. Lots of iconic athletes have come through the Paralympic Games, including Tanni Grey-Thompson, Mike Kenny, Trisha Zorn and Daniel Dias. And that's how, from a small competition for British veterans, the Paralympic Games began.
Okay. Sorry, I can't go back to the presentation.
That's directly problem, no problem. It's normal.
Yeah, that's right. Thank you, Anna, for supporting me.
Okay.
In Paralympic Games, there are two sports that they are only for disabled people, and they are boccia and goalball. Maybe you know boccia. It's very similar to petanca. In Spain, it's very typical. It is spilled in parks, and it's very known. And goalball, it's a spiel for vision impairment people, and where they all spill without being able to see, just to.
Excuse me, can you put complete the screen? Because
yeah.
Okay. Thank you, Noah.
Thank you, Anna. And it's spilled with a ball with bells. It's if you have the opportunity, it's very interesting to watch. So we go on. Sport as a tool of integration. People with disabilities face numerous barriers in their daily life. And in almost all aspects of their lives. Barriers can be physical, social, or psychological. When we usually think about barriers, we usually think about architectonical barrier. They are very important, but they are not the only one. Also, lack of specialized coaches, specialized clubs, competition to access, limited opportunities and programs for participation, training and competition. And that's why we're here. Lack of understanding and awareness of how to include people with a disability in sport. Sometimes it's not the willing of including, but the lack of knowledge about how to do it. And if we haven't had any experience with disability, at the beginning, we are a little bit scared. Myth, stereotypes about the capabilities of disabled people. Lower society expectation. When we talk about disability, or we think about having a disability, we usually think about it in a negative way. That's why our expectation for people with disability are usually very low. And of course, relatively low income levels and lack of confidence and sure of ability. Sometimes the people with disability don't trust themselves to practice a sport, and it is also a very important barrier. By helping to overcome these barriers, we will be favoring the inclusion of people with disabilities, and the practice of sport can help to overcome these barriers by providing inclusion. Promotes labor integration through tailored training. A 2015 study described the relationship between the practice of adapted sports and the employability of people with disabilities. concluding that individuals who practice sport have an increased employability profile in contrast to those who did not. And that is very important because the employability in people with disability are very, very low. And of course, if you don't have a job, you don't have money. It's a vicious circle. And on the other way, if you have a job, you can have more money, you can get more sport experience, and of course, you can be more integrated. Additionally, one of the committee's long-term goals is to create kickboxing training so that people with disability can work with or without support in jobs related to the practice of kickboxing. Benefits of sports of individuals with disability. The benefits of sport are similar for people with and without disabilities. What differs is the starting point in the different areas in which sport shows benefits. And these are physical, psychological, and social. The practice of sport is significantly lower in people with disability, largely due to the barriers they face and that we have mentioned before. So they need more, or they really need the practice of sport, but they have more barriers, and the practice of sport is lower. The health condition underlying many disabilities make it even more necessary for people with disability to practice sport in order to benefit from its positive effects. It's also important for people without disabilities because, of course, the healthier we are, the better we will be when we are old. It's like a prevention way. It's a prevention to do sport. It's the medicine of the future, so we can say something like this. But it's very important to practice sport, and it prevents from disabilities, even for the people who has no disabilities at the moment. These benefits have an impact of the autonomy and quality of life of people with disabilities. In addition, it prevents the worsening of some health condition associated with disability. An example would be Down syndrome. Because of the syndrome, people tend to suffer from obesity, and this risk factor can be alleviated through sport. And, for example, some non-communicable disease can cause disability. An example could be diabetes. Diabetes can cause amputation and visual impairment. If we avoid diabetes, we can avoid disabilities. Sport improves general physical fitness, endurance, mobility, speed, flexibility, etc. Coordination, orientation, and balance. It also improves health by preventing diseases associated with a sedentary lifestyle, and improving vital functions such as respiratory, cardiovascular, and even renal function. The psychological benefits are a lot. The negative image that is still held about disability leads to a low self-esteem and low expectation of oneself. We have been told before, but if you grow in an environment where you are always told that you are disabled, that you can less, that you can't achieve the same goals, you are going to believe yourself as well. And of course, your self-esteem is going to be not as good as could be in other way. And as I mentioned before, when we talk about disability, we always do in a very negative way. Through goal setting, sport can become a tool to boost confidence and improve self-esteem. Sport can also lead to an improvement of mood state with a reduction of anxiety and depression and increased feeling of greater self-efficiency. Social benefits. People with disability, and especially people with intellectual disabilities, find it difficult to widen their social circle as they have few possibilities to meet new people. They usually live whether with their family or in an institution with other people with disability, and they go to work with people with disability. So they have very few opportunities to meet new people and people without disabilities. People with disabilities who practice sport regularly feel more included in society, interact with peers, and develop social skills and a sense of belonging to the group. I would like to tell you a personal experience. In one of the competition, I was talking to a athlete, to a woman with disability, and I asked her, and what is for you the best of practicing kickboxing? And the answer was to feel normal. And that was for me very shocking, because I was seeing, or I could feel how he was feeling about being a disabled person or to have a disability. So inclusive para kickboxing. Now we start with the para kickboxing. What is para kickboxing? Kickboxing practice designed for individuals with disability. As we heard before, we want kickboxing to be for everyone. To whom is it addressed? It targets athletes with disabilities interested in practicing, training, and competing in kickboxing. To practice and to develop kickboxing, para kickboxing, we need some figures for the advancement of para kickboxing in the federations. And these figures are sorters, coaches, referees, and sport coordinators. Anna, please.
Yes. Okay. So the sorters, we can see they are trained and certificate individuals responsible for assessing athletes to determine their classification based on disability, assigning them a sport class to enable fair competition. So it's one of the most important things in this webinar. In this case, the sorter is one of the, perhaps not the most, but it's one of the most important parts in this seminar. So please next, perhaps. Okay. So the first of all, in this picture, for me, it's necessary to say that in this picture we can see Juan. Juan is one of our referees, black belt, and he has a disability. So it's the best example to say that the kickboxing is for everyone. Referee, black belt, athlete. So I think it's a really good example. So the picture, yes, okay, next. So the classification levels, we can see the different one. It's easy. So the elementary level is responsible for gathering information and conducting an initial classification with the assistance of the classification team. It's important: doctors, psychologists, specialized technicians, and classification table members. Okay. Luego, the intermediate level, so it's responsible for overseeing the official national classification process with the supervision of the classification team and classification table headers. And the last one, the advanced level, is responsible for issuing the official international classification and head of classification table and international competition. So all sorters must engage in ongoing training to stay current. Otherwise, they risk losing their classifier accreditation. So coaches, your moment, or I can say coaches, or I can say coaches, they are responsible for developing tailored training for individuals with disabilities. Next, the special referee, hoursFor family. The second most important part in this webinar. Referees, they are professional trainers in refereeing and disability, responsible for ensuring that the rules are followed impartiality, very, very important, impartiality, please. In boxing, referees and judges run and manage the tatami competition area. And special mention to sport assistants, because coaches are necessary for training, but sport assistants are very, very important too, because the sport assistant, the figure of the sport assistant is of great importance in disability. This is a person with knowledge of kickboxing and disability, not only in technique, not only kickboxing, it's kickboxing and disability. So based on the personalized training carried out by the coach, he or she is responsible for generating the necessary support so that the person with a disability can achieve the goal set. This involves adapting the spaces, materials, and the training sessions, among other things, to help the person with a disability to reach their maximum potential. They also help the athletes with a disability in the competition, providing the necessary support, not only in the sport area, out of the area, all the time. Along the competition, the sport assistant must be there, because the necessaries can appear in the moment, not only in the competition. So this figure is necessary in all disabilities, but it's almost essential in intellectual disabilities, and they work in close collaboration with coaches. So next, please. And well, the goal part of the webinar.
Milestone.
Okay.
Categorization process. Which action has to be taken? The classification process starts with the application of the interested person or his or her legal representative, who will have to provide the requested documentation, valid license, medical documents for disability assessments, video demonstrating of technical skills, and meeting with the categorization team. Once the documentation has been analyzed by the classification panel, the athlete is declared eligible or ineligible. After the athlete has been designated as eligible for a sport, the classification panel will assess which sport class the athlete will compete in. And he or she will have a certification in sport class that allow her or him to compete. Anna?
Okay, so now we start with the sport classes. So we have the different ones: physical impairment, intellectual disability, autism, vision impairment, and psychological disorder. So the physical impairment, we have from P1 to P5. We can see the different one: wheelchair, passive range of motion, limb deficiency or amputation, cerebral palsy or general dystonia, and wheelchair or walker. So next, please. Okay. So we will see different videos about the different sport classes, or the most not most important, because there is one more important than another, but to see the different ones. So sport class P1.
Oh, sorry.
Yes, of course. No problem. The lower body engagement and yes.
And wheelchair.
Please. Yes, well said.
Yes.
No problem.
Okay.
Yes. Perhaps it's better without sound, and I can explain while the video is on. Okay. In this case, we must see the wheelchair is different one. So the wheelchair is very important. Must be safety, and they need to do the quickly movement. So must be special for the sport. The coach, we can see, kick and punch, but not directly to the athlete. It's only to be kicks and punches must be blocked by the athlete, but no impact in the athlete. The movements, block. The athlete can move the wheelchair to block. Okay. And all time is moving, moves, and he can make the technique completely. Then in a safety environment, always the safety is the first of all. It's very important when one athlete with disability start the technique, they must say how long is the technique, from 30 seconds to 1 minute and a half, more or less. And it's one part of the judges must have in count to judge that technique. If one athlete says that is 30 minutes, it's 30 minutes, or 30 minutes. In 35, minus point. And the judges must be conscious the long of the technique. The next one, please. Full screen is better perhaps for people who is at home. Okay. The sport class P2 is passive motion range, ataxia, and muscular weakness hypertonia. Okay. In this case, you can see medium. Wait for the video. Okay. So slowly.
Slow
the problem with the director. Okay. In this video, for example, we can see that the coach is indicating the technique that must be performance, because we must take into account that disability can be associated with being able to memorize. So sometimes Sometimes in this case, for example, the coach tells the technique, punch, kick, because the fighter is not able to memorize the technique. Okay. Perfect.
Thank you, Miriam.
Yeah, thank you, Miriam. Okay. Sport class P3 is limb deficiency or amputation, stunted growth. Okay, in this case, yes, start, yes, okay. In these cases, we must take into account with athletes with prostheses that the techniques they perform with the prostheses are very, very powerful, even they are aware of them. So they must control the kicks or punch they perform with them, because the prostheses, normally the materials are very strong, so they must be careful with the kicks and punches. They must control the balance, and the judges must have in count in this case, for example, the balance is very important in this technique. Okay, you can see the total under control, the kicks, because in this case, the arm of the fighter is the prosthesis, and he can damage the coach. Okay.
Sorry.
It's okay. Sport class P4 is cerebral palsy or generalized dystonia, standing. Okay. So in this case, Luis. Okay, in the case of athletes with cerebral palsy, we must take into account that the balance of movement is something that requires great effort for the athlete. So all this must be taken into account when scoring the difficulty of the techniques. So it's very important all judges know the different disabilities and capacities, because in this case, the balance, we can see the difficulty is the balance for the athletes. Okay, a really good job. Yes, tell me now.
Now, Anna, someone is asking if it's possible to compete with a prothese. If it's allowed to compete.
Yes, compete with, sorry?
With the prothese.
Ah, okay, yes, of course. Yes, of course. Okay, I can see the answer, the question. Okay. Sport class P5, mobility aid, involvement of the lower and upper body due to cerebral palsy or disease. Take a moment to see this picture or this video, because you can see the word say is totally different, but in this case, it's impossible to change it because it's necessary for this athlete. And the most important in this case, in this athlete, for example, is we must take into account where we start from, since we have an athlete with an extreme limitation of mobility, and how far we go, seeing that thanks to the practice of kickboxing, for example, she managed to develop a front kick, for example. Front kick for this athlete is a goal. It's a really goal. We can see it's the real example that kickboxing is for everyone. So I prefer to you can see the video because I think that is better than me explain more. What's forms in the most inclusive and comprehensive model like this? Yeah.
Okay.
Okay.
I will try to talk.
I can do it if you prefer.
No, I'll try.
I'll do it. Okay, perfect.
Intellectual disability, as you can see, there are a difference between intellectual disability and Down syndrome, and that is because people with Down syndrome have hyperflexibility and more joint mobility than the average. That's why they have a specific category. In order to be fair, Anna?
Yes, of course, no problem. I can do it. So a sport class DA1 is mild cognitive impairment. It's from the 55 to 70. So the video. Okay, in this case, it's Milagros, and it's important that here, for example, we can see that we can find ourselves in cases where it's necessary to adapt the path. In this case, in which, for example, we use pool noodles, are used because the athlete's fingers are stuck together, and it's impossible to wear gloves and close her hands. In this way, we prevent the athlete from unnecessary injuries. So it's an example that we can adapt everything for the athlete to prevent damage, and in this case, she can kick and punch, total safety. Okay. As judges, we can see we must see the balance, the difficulty of the techniques for in this case for this athlete, and in this case, for example, because I meet her, she is 60 years old, so it's a good example. One more time that kickboxing is for everyone. It's marvelous. Okay, sport class DA2 is a cognitive impairment, moderate or severe, and AQ below 50-55. Please pull full screen, please, because it's better, I think, at home to see. Okay. Okay. In a moderate disability, the combinations will not be complicated or very long, because the limitation of learning routines and sometimes limitation in movement is included in this disability. So we can see short techniques, easy, but in this case it's easy because she needs them. But we can see short but well done. So gold medal in this case, for example. It was gold medal. Okay, sport class. Okay. SDA1 is male intellectual disability associated with Down syndrome, AQ 50, 55 to 70. Okay. In this case, it's a good example. What's important is the classification, because here we can appreciate the importance of having different levels of Down syndrome. Because, for example, in this case of this athlete, despite having Down syndrome, he's a very high level athlete. His techniques are performance with balance, good technique, and powerful. So it's very important, the levels in this case, because later we can see the difference with a short level like this, or the next one, we can see very easy the difference between them. We can see good balance, good techniques. Okay. And the next one, for example, sport class SBA2, Down syndrome entails a moderate intellectual disability, AQ below 50, 55. We can see the difference. Okay, let's start. Okay, so in this case, we can see that his level is more moderate. The speed at which he performs his techniques is slower because he needs to maintain his balance. And he needs his sport assistant to remind him of the technique he must do. It's total different. So it's important, the different levels.
But the height of the kick are in both cases very, very remarkable.
Yeah. Okay. Are you right? Yes, of course. We cannot ask to this athlete the same speed that to the other one. But in this case, for his level, is really good work.
Okay.
Well done. Okay. Okay. autism, autism spectrum is an special one because we must have a special environment with this kind of athletes. So if please know if you can put a sport class A1, high functioning autism AQ studying 75.
So, may I, Anna? This autism in this level, they have no intellectual disability, but they have special needs, and that's why they compete in the para kickboxing.
Yes, thank you. Okay, in the case of athletes with autism, we must take into account that the environment that they are in can greatly affect them due to excess noise, light, and they may need to use sometimes noise insulating helmets. Any change can affect or unblock them, so we must consider letting them be the last in the competition because there is normally less noise and not make change to the timetables in the competition or change in the competition area. All of this can affect them. So,
and that's why a sport assistant is so important, because it's the person who knows what the athlete need. And of course, they are working together for a long time. And when they arrive to the competition, they know each other, and the sport assistant knows the needs of the person, of the athlete.
It's a good option if they arrive earlier to the area and try to be with the noise, with the light, to know their environment, and to be quiet and to be more quiet.
And as you mentioned, the schedules and everything, they need a predictable environment. And of course, for them, it's not a usual or an environment that they very know. So they needed to do it in advance. That's a escape. Sorry, technical.
Yes. Technical problems, no problem.
Technical problems. I don't know why now.
Okay, so vision impairment. This is V1 or V2 is the difference is totally or almost totally blind or partially sight. So we have here two good examples. A sport class V1 is severely visually impairment or total blindness. Okay. Okay, so in this example is Salvadora. Okay, Salvadora is total blind. In this case, we can see that the sport assistant continually speaks to the athlete, but is not to remind her the technique, so that she can locate herself at all the times and have the reference of the path. So, and we must assess whether in the future blind people compete with masks. We are looking, we are thinking about it. But yeah,
it's like,
it's very
like in goalball. I've talked before. In goalball, they all use that. I don't know the name.
okay. The maximum. Okay. That is very important. The assistant in this case only to have the path to do the technique. Okay. Sport class V2 is vision impairment, partially seated, and here. Okay.
Yeah, sorry.
No, it's okay. It's okay. Retains some vision. It's full screen.
Yeah, I'm trying to. I don't know why the computer.
Yeah.
It's not working as well as I would like to.
No problem. Okay. So in case of partial vision, athletes have the reference of their sport assistants, but it may be necessary probably to adapt the clothing or and pads with colors that facilitate the development of technique. In this case, it's not necessary, but it could be necessary. Perhaps other yellow or in orange, in other colors, the assistant clothes or pads to be easier for the athletes. In this case, Eris is a really good fighter.
Yes. Okay, it's not working. Wait.
No problem.
It works.
Okay. Good job. I think that Eris is the younger, the younger athlete in our championship.
And
what so it's an example.
Yeah, and what I really like from this video is like she's having such a fun.
Oh.
she's enjoying it that much.
It's true.
Escape. Okay.
Okay. Psychological disorder is M1, M2, and it's a moderate or severe. It depends. And
it's a percent of psychogenical disability.
Yeah.
It depends. It's a diagnosis, and this could be in the classification.
Okay. So in this moment, the mental illness is not recognized in the Paralympic Games. And let's say that in our case, we have it in a transitional period of testing. So it's the first time that these athletes, for example, took part in our national championship, and we are testing that. Yes, okay. We can see.
If they are taking medicines. So some medicines have effects on the balance and on some things that are very important for competing, and it's also necessary to take it into account.
No, one question while we see this video. For example, if one athlete take you have said, as you say, some medicine that the balance can be affected, is necessary perhaps put in the certificate, or it's not necessary because it's only a medical, I don't know.
If it's a very important balance problem, it's going to be in the not in the diagnosis, but in the medical formula. Yes, because it's very important to know. It's something that affects on the development of the sport.
Okay, because now as judges, I say, oh, okay, I didn't know it, but it's important to know. Yes, thank you.
That's very good, because we also have questions, because we are building up to para kickboxing. That's why we are here. We need the contribution of a lot of persons that are going to be a part of this amazing thing. And of course, we also have questions, and it's under construction.
Yeah. It's right. You're right.
Okay.
Yeah, I think that it was the last video.
Yes.
Okay. Bueno, regulation, the guidelines, and the rules. I think, bueno, it's responsible for establishing rules and procedures, as well as setting the foundations, procedures, sports, categories, and competition formats. And the focus path regulation. Yeah, no, it's okay. Regulation establishes the foundation for ensuring fair and safe competition. I think that this document you can find. No, I don't know if it's already are in the web or in the mail, or I'm not sure. But if they aren't, they will be. So no problem. You have very early all these documents to review, to learn, to memorize, and to ask about them, because we need to improve. So all your contributions are well accepted. So.
Yes, are welcome.
Are welcome, yes. So thank you, everyone. So thank you all.
Yes, thank you very much. You can, if you have some questions, you can ask them on the chat, and we will try to answer them, because I think there are some already.
Okay.
I think.
Yeah, probably. You can see the questions
in the.
Okay. Okay.
Not in the chat. I think someone has asked if the sport assistant get medals in the Paralympics. The guides in para athletics and para cycling get medals from London 2012. Before London, they didn't get a medal, but in London it was decided also to give a medal for the guides. And it's also a very important part of the Paralympic Games. Otherwise, they couldn't compete. And in our sport, I think that we don't know already, so we have to decide how to do it. At the moment, I think they are not getting medals, but
no, in this moment only the athlete.
it's nothing official is decided. So we have to think about it.
I take note. No problem.
Write down every question, and of course, any contribution are welcome.
So, any question?
Any
Other
questions?
question?
I think Jesus, you wanted to ask a question, if I'm right? Silence.
We can wait, no problem.
Hi from Extremadura.
Okay. Hello.
Thank you. But we can, if one person stay in B and one and another in two, they compete between them, or each sport class has its champion. They compete in their sport classes, and that's why we are studying how to do it, because if they have the I think that we don't know the name, they can compete together.
Yes.
But at the moment there are two sport classes.
We can say, I think that we can say max, but for example, in other sports they use it, so
yes,
we can do it, but we are under construction. So,
Jesus,
okay, do you listen me?
Yes.
Perfect.
Okay, about the question about why paths or not forms, is that President Baker and me talk about this, and Roy tell me, Jesus, no, the rest of the combat art sports, there are forms. What is our special apparatus for training? This is the paths. This is the focus, the myths. And this is for that we begin only with this proof. It's possible change in the future, but now this is our difference. Only us training with this kind of things. Only us. This is for that. What is the difference now? This is the use of the different paths or myths or other things. If the athlete is not available to use his hands, put a gloves, close the hands, all that the athletes need, okay, to show his abilities. This is for that we use paths and not forms. Karate has forms, Taekwondo has forms, the kickboxing at the moment, paths, okay? But we are in development. In the future, I don't know, but I think that our presentation is with the specialty of kickboxing. Everything that watch our competition think, oh, this is kickboxing. This is no karate. This is not other martial arts. Thank you for your question, and now continue the teachers, please, and congratulations.
Thank you.
Okay, another question is how we can classify an athlete who has more than one syndrome. For example, autism and blind. Thank you for the question. It's a very good question, because it's very usually that people with disability have more than an impairment. For example, some syndromes are related to intellectual disability and vision impairment or whatever. For example, Mila, the woman with the pool noodles, she has also vision impairment and also ear impairment.
Okay.
If they have more than one or more than two, the one who is more limiting is the one who is the eligible. For example, if they can see more or less, but they have a limb, a lack of limb, it could be the lack of limb, for example.
Mhm.
But in every case, the assessment panel will study the situation and will assign a sport class. Does a walkover exist? Like if there is just one competitor in his class? So the thing is, maybe there is only one person in one sport class and under contraction. So we are we are thinking about the best solution. The best solution to solve this situation, because we have already thought about it.
Mhm.
Because can happen. And I think some more questions.
No, I can't see more. We can wait any more, 1 minute more.
That's this one, Anna. One.
Huh?
If this is a sport of two people,
Huh?
I think that has also to be with the medals. If I understand good, maybe you understand better the question.
One question: if this is a sport of two persons, yes, I mean, it's a team sport more or less. It's one athlete. And in this moment, bueno, Noé has said that in this moment, only the medal for the athletes, but we will see probably in the future, we can give medals to the athletes and to the coach. But in this moment, we must say that it's the athletes, because the coach is an assistant. So we will see if it's a team or it's not a team. So we will see.
Jesús?
Okay, I think that we have near of 2 hours of webinar. I'm very happy for that. I'm very happy, and thank you very much for all the people that is here, principally many of my friends and presidents, continental presidents, 100 people for the 5 continents was in the seminar.
Amazing.
It's a big success. Very, very important, the introduction and the support of the President Baker. We are a team. We coordinate with Romeo Deza, the technical director, with all the presidents, with the board of WAKO, with all the Continental's presidents. And I'm very happy that all the WAKO family, many people of the WAKO family is with us in this moment. Okay, from the people that Spanish countries, para la gente que habla castellano, no os preocupéis porque enviaremos también esto todo hablado en castellano. Todo se va a subir en YouTube y podréis descargarlo en castellano para verlo también. Este es un primer contacto y a partir de ahí iremos poco a poco trabajando. Don't worry, this is our first contact, okay? This is the start. This is the first round. This is the first round of our mission for our dream, the kickboxing dream. how is that kickboxing is for everyone, and only one federation, WAKO, only one federation, only one championship, and the kickboxing is possible for everybody. Do you want? Do it. Thank you very much for all. I hope to see you very soon, to the second round. Thank you, my friends. Thank you for all the women's and men's that are involved in this amazing adventure. Thank you very much.
Thank you.
Thank you very much, and see you soon.
I hope so.
Thank you. Thank you.